Hello, my name is Michele Romano and I am the Physiotherapy Director of EASICO, an international reference institute for the conservative treatment of spinal disease. I would like to take a few minutes to give you some background information on CEAS, the acronym of a conservative treatment method for scoliosis. The meaning of this acronym is Scientific Exercises Approach to Scoliosis. The word exercises and scoliosis are almost clear, and it means that CEAS is based on specific exercises for the treatment of this spinal misalignment. The word approach, it means that the CEAS is not a rigid method, but it can be modified with respect to the patient. CEAS is one of these very few methods that have been validated internationally thanks to the publication in the scientific literature of a series of studies that have demonstrated the effectiveness of this methodology. This is the meaning of the word scientific inside the acronym. CEAS is characterized by a thorough evaluation. The purpose of this portion of treatment are two. The first aim is the classification of the pathology, that is, the objective measure the three-dimensional misalignments of the spine obtained from the X-ray that must be measured precisely. These measures are combined with the clinical evaluation of trunk asymmetry to identify the active self-correction to teach. Self-correction is the set of small movements that the patient tries to perform to reduce the curve. The active self-correction will be the most important action that the patient will train during the treatment. The combination of X-ray and clinical data are collected in a table, suggesting the first reasoning to design the theoretical active self-correction. You can see that there are three columns with the typical movements used to correct the curves upon a coronal, horizontal and sagittal plane. There are two lines. One is indicating the X-ray and the second one the clinical measures. The intersection between columns and lines underline the reference measures that suggest the movements that have to be taught. For example, in case of apex vertebra rotation that is more than 15 degrees, a derotation movement is suggested. Or, if the coronal imbalance is more than 20 millimeters, a coronal shift as a corrective movement is recommended. There is a fundamental difference between CEAS self-correction and a correction taught in methods different from CEAS. In the CEAS self-correction, the aim is not to teach the movement able to recover the best possible realignment, but to teach the movement able to reach the more manageable realignment of the spine. The reason is the final purpose of the treatment. The integration of the self-correction in the daily life activity. The obligatory consequence is that the self-correction is taught without external helps or performed in no physiological position of the body. If the aim is the real integration, we must accept that the self-correction won't be the best realignment. This is a conscious decision and not a result of a sudden craziness. This table is going to be the main and primary tool to identify the corrective movement much more suitable for a specific patient. The scoliosis, composed by more than one curve, are one of the biggest real daily problems for treatment based on self-correction.
In this case, the suggestion table is not enough, and the use of a waterfall algorithm will be necessary to set the more complex self-correction pitch. The algorithm is difficult to explain in this video. It's composed by a set of some consequential smart decisions necessary to design the reasonable, effective self-correction. The effective self-correction is a list of movements that we can really teach. This correction is different from the list of corrective actions that are able to reduce theoretically all the misalignments in all planes. This amazing self-correction is composed by all movements we would like to address to our patient. It's named theoretical self-correction and is our impossible dream. By the way, is it possible to correct the misalignment of the spine without external helps? This is an example. The correction that the young girl performed is the derotation movement in clockwise direction to apply in case of left lumbar curve. As you can see, the patient in this video is nearly moving in perfect way. In fact, not all the patients are able to perform the same correction. In reality, only very few patients are able to have the same finest control of the spine sector movement like she's having here. This is a proof that we cannot teach the same self-correction to all the patients, and that the identification of the effective correction is really linked to their ability. Considering the SEAS point of view, the basic aim of scoliosis conservative treatment is the training of the self-correction use during the daily life activity. It means we need to increase more and more the ability of our patient not to lose the learned self-correction. It means we need to increase this ability. This ability is named stabilization. This word is used in all the exercise methods practiced all over the world. Me too, I will continue to use it, but in my mind the word more effective is management. It means the increasing of the skills to reach the correction, to use and not to lose it during the daily routine. It's clear that the patient cannot fix this new posture, but train itself to improve the ability to handle it. For this reason, the second aim of the assessment is the investigation of the functional characteristic of the patient. This will help to understand which exercises to use to progressively increase the stabilization of the correction. The results of the test allow the type of difficulty to be included in the exercises to improve the ability to hold the correction and learn how to incorporate it in their daily life. What are the exercises in the SEAS division? They are considered special tools used to challenge the correction maintaining. The exercises will be prepared after the assessment of the patient. The more the patient possesses fine motor dexterity skills, the more complex the exercises will be, because the aim is to challenge the patient to handle the correction. This will only be possible if the complexity of the challenge is related to the patient's ability. In summary, the aims of the SEAS exercises are two. The first is the challenge to the correction holding, and second is its consequent result. the improvement of its stabilization.
The next video is an example of difficult exercise that the patient performed holding self-correction. Obviously that not always the self-correction is the lumbar derotation. I chosen it only because it's one of the more complex to execute. You can see the patient performing a clockwise derotation of the lumbar spine, obviously. Holding the correction, the patient will perform a set of challenging movements without losing correction. Then she will go back in starting position and relaxing correction. You can appreciate the appearance of the original left lumbar prominence. What does it mean? It means that the patient is able to hold the correction and that the difficulty of the challenge is not too much. The correct application of SEAS requires a dedicated software that is used to collect assessment data and organize exercise programs. It's important to be efficient and to always ensure that the entire treatment path has been prepared systematically. Finally, we can talk about the app for mobile phone. In fact, EasyCo has developed several tools for patients and professionals as apps, which together with the internet increase the quality and improve the professional image and our therapeutic efficacy. Dear friends, dear colleagues, thank you very much for your attention. Hoping to see you soon. I send you a warm ciao from Italy.